Expert says line of gas in post-mortem X-ray was unusual. A line of gas in front of the spine was an unusual finding on the post-mortem X-ray of a baby allegedly murdered by nurse Lucy Letby, her trial has heard. Paediatric radiologist Professor Owen told Manchester Crown Court that its appearance was, quote, consistent with, but not diagnostic, of air having been administered. Letby, 32, is said by the prosecution to have injected air into the bloodstream of the newborn twin, child A, who later collapsed and died on the evening of June 8, 2015, just more than 24 hours after his premature birth. Jurors were told that Professor Arthurs, Professor of Radiology at London's Great Ormond Street Hospital, had been instructed to review X-rays taken of child A when alive and after death, as well as other babies in the investigation. Looking at one of the post-mortem X-rays, he highlighted to the court there was gas within the bowel, a normal feature, he said, and also the heart. Prosecutor Nick Johnson QC asked, anything unusual about the X-ray? Professor Arthurs replied, you can also see a line of gas just in front of the spine. That is an unusual finding. He said such an image would not be seen in deaths by natural causes, but had been documented in cases of road traffic accidents and sepsis infection. He went on, quote, in my opinion, this was an unusual appearance. In the absence of any other explanation, this appearance is consistent with, but not diagnostic, of air having been administered, end quote. Professor Arthurs said he could not say from the image alone that an air embolism, a gas bubble which enters a blood vessel, was the cause of child A's death. The court has heard previously that child A did not have intravenous fluids for up to 4 hours on June 8th before he received glucose through a long-line plastic tube at 8:05 p.m, shortly after the defendant came on duty. Earlier on the shift, a cannula to a blood vessel stopped working, followed by 2 failed attempts to correctly insert a catheter in the belly button. Professor Arthurs told the court it was, quote, possible that gas could have been introduced by one of those above devices. Mr. Johnson, on behalf of the prosecution, asked, have you ever seen this much gas in a baby that has not been explained? Professor Arthurs replied, only in one other case. Mr. Johnson said, one of the other children in this case? That's right, replied the medic. Professor Arthurs said he based his opinion on a published peer-reviewed study in 2015, which looked at how common it is that gas occurs in older children who have died, albeit with very few babies included in the study. He went on to review the deaths of 500 infants at Great Ormond Street. The radiologist also reviewed the X-rays of child A's twin sister, child B, who the Crown say Letby attempted to murder via an injection of air on the following night shift at the neonatal unit. Professor Arthurs said he found no significant abnormalities on her radiographic images, including an X-ray taken 40 minutes after child B suffered a sudden collapse, which the Crown say Letby was responsible for. The court also heard evidence from a woman who had been a neonatal unit nurse shift leader at the Countess of Chester Hospital on June the 7th. She recalled she had, quote, never seen a baby look that way before, with a skin discoloration on a pattern she had never seen before. Asked to describe the discoloration, she said he was white with purple blotches with a bit of blue, and it had come on very suddenly. Letby, originally from Hereford, denies all the offences said to have been committed between June 2015 and June 2016. The trial is now resuming, with the next witness Professor Owen Arthurs, consultant paediatric radiologist at Great Ormond Street Hospital, giving evidence. Professor Arthurs is asked about a post-mortem X-ray for child A. He comments, quote, unusual findings in gas and air found in the baby boy, including a line of gas just in front of the spine. He said such a finding is not found in cases of natural cause deaths in babies. Trapped air such as this, Professor Arthur explains, could be found in cases such as road traffic accidents or infections such as sepsis, overwhelming infection in the organs of the body, or very occasionally outside of hospital in sudden unexpected death in infants. The prosecution asked, have you seen this much gas in a baby before? Professor Arthur responds, only in one other case, which I think we'll explain later on, another of the children in the Letby case. The prosecution ask, "What was your final opinion?" Professor Arthur responds, "This was an unusual appearance. In the absence of any other explanation, this is consistent with air being administered." Ben Myers' KC, on behalf of the defence, is now questioning Dr. Arthurs. He asks questions about air in the body and analysis of them. Mr. Myers asks, "Radiographic evidence of air embolus is rare, isn't it?" Professor Arthurs replies, "Yes. On post-mortem imaging, the presence of air may also be the result of medical procedures or placement, is that right?" Professor Arthurs responds, "Yes." Mr. Myers asks if the presence of a UVC or long line for some time could lead to air in the system. Dr. Arthurs agrees. Professor Arthurs says the assumption that an image is needed to prove an air embolus is wrong. Professor Arthurs says his review of the cases led him to give a conclusion of unusual, having looked through a number of past cases. Mr. Myers says that translated to similar findings in 25% of the total number of past cases he had gone through. Mr. Myers says Professor Arthurs looked at 500 cases at Great Ormond Street Hospital, which, after narrowing down the criteria, amounted to 38 babies aged under 2 months, and of those, 8 had gases in the greater vessels. Professor Arthurs said there were no unexplained cases of gases in that location. The causes found included trauma, a road traffic accident, sudden unexpected death in infants, or congenital heart disease. Mr. Myers said that does not include many cases of babies in similar circumstances of death of babies aged under 4 days old. He says there are many variables in such a study. Professor Arthurs says air can be distributed in the system during CPR. For child A, Mr. Myers says one possibility of the air seen on the image is air administration. He says others can be through resuscitation or post-mortem changes. Professor Arthurs responded, "Yes." The court is shown for child B, the radiograph image shown from June 10th, about 40 minutes after the time of the non-fatal collapse. Mr. Myers, on behalf of the defence, states, quote, "On that image there are no features which support an air embolus diagnosis." Professor Arthurs replies, "Yes." He clarifies from a question by the prosecution that it could not be concluded either way. Professor Arthurs says his observational study was from a large body of evidence. The judge, Mr. Justice Goss, asked about the study as the jury has not seen it. Professor Arthurs said the study was carried out for children up to 18 years old in 2015 and looked at 35 cases, with 10 having some gas in the larger vessels. The study was published, peer-reviewed and available in literature. He tells the court probably none were of premature babies. The study was performed independently of the trial the court hears, and was prior to Professor Arthur's own review for babies carried out later at Great Ormond Street Hospital, involving hundreds of cases. The next witness to give evidence is senior neonatal practitioner Caroline Bennion, who was present for the delivery of Child A and Child B in June 2015. She recalls that Child B required assistance at birth and that support was given for her. She explains more support was required for her than Child A. Child B recovered well, and after review she was tried off the ventilator as she was vigorous and was breathing by herself. She is now being asked about the significant event for Child A on the evening of June the 8th. Child A suffered a collapse and died during that evening. She says she was in the room when that collapse happened. She knew she had taken the handover, a comprehensive update from the daytime shift staff from 7:30 p.m, and carried out equipment checks. She said from reading her statement she was next to Child B and still doing her checks and completing observations and safety checks at the time. She said she wouldn't have left Child B. She said she remembered Lucy Letby asking for help on Child A. When it became more obvious she needed assistance and Child B was safe, I went over to help. She said she did not have a recollection whether the alarm went off. She said it was a busy evening, with babies having long lines put in and the nursery was quite full, with the crossover of day and night staff. She also said Dr. Harkness was in at the time. She recalled she helped Lucy Letby give some ventilation breaths via the NeoPuff device. She said there was no crash call put out as the doctors were already in attendance. The nurse recalls drawing up the emergency drugs required during Child A's emergency treatment. Child A passed away following a series of resuscitation attempts. The nurse said she then returned to treatment of Child B. The court is shown the nurse continued to take hourly observations for Child B. She confirms, quote, nothing unusual was noted during the rest of that night shift. Questioned by the defence's Ben Myers KC, the nurse says she had many years of experience in neonatal care. She is asked about if there were challenges in staffing levels. The nurse replied, we were always very fortunate to have a lot of senior staff. There were occasions where we had busier periods, but that is the nature of a neonatal unit. The nurse agrees the babies were vulnerable and could deteriorate very rapidly. She agrees it was known a deterioration could happen when a baby was almost ready to go home. Miss Bennion is asked about medication that is given to babies who would otherwise be at risk of infection. For Child A, she is asked about such a prescription, and the clinical indication is for suspected sepsis on June 7th at 10 p.m. The administration of the dose is dated at June 7th, 10:46 p.m. Miss Bennion is shown a copy of the neonatal record chart about how some of the tasks and times are shown taking place on the hour when they might be around that time. Mr. Myers says that as some tasks take some time, it could give the impression a member of staff was in two places at once. The nurse agrees. Miss Bennion is now being asked about Child A's collapse and that Lucy Letby had called for assistance. She said, quote, we have an emergency buzzer which could be pulled, but there were so many staff that a nurse can call for assistance. Mr. Myers asked, that would be appropriate? The nurse replied, yes. Miss Bennion is asked if there was any formal support for nurses, particularly for dealing with incidents such as when an infant died. She said there was no formal support, but said of the nursing team, we were very supportive of each other. She said there was no formal procedure or form for everyone to fill in. She added, quote, under the direction of the medical staff, a debrief would always be offered. We have a supportive management team, and in the network of our close unit, if a nurse did not want to return to room 1 for the following shift following a traumatic event the previous shift, that can be provided. Even after a tragic event, you have to remain professional in the care you give. Miss Bennion adds, from a follow-up question from the prosecution, that simultaneous observation of two babies would not happen, even if the documentation would appear as simultaneous on the records. She was asked about the speed of the deterioration of Child A. Miss Bennion said it was very rapid, very sudden. It's like a jigsaw, you're putting in observations, but there was nothing to say Child A was going to collapse. However, it has happened and it can happen. The next witness is someone who was also working at the Countess of Chester Hospital as a neonatal nurse in June 2015. She describes on staffing levels, quote, there were definitely periods when we were short-staffed, periods when we were okay. For shifts when they were short on numbers, they would look to bring staff and swap on the rota, or if anyone could do an extra shift. Agency or bank nurses were a possibility, but it didn't happen very often. The nurse was the shift leader at the neonatal unit on the night shift for June 8th. Lucy Letby was one of the designated nurses. The nurse remembers walking by the neonatal unit room 1 and seeing Dr. Harkness in there at the incubator for Child A. Swipe data showed her coming into the neonatal unit at 8:20 p.m. She said, quote, I was like, something has happened. With my experience, I was thinking he was having a sort of episode that babies can have. She believed it was down to one of a number of medical conditions. She recalls seeing who else was in the room. She recalls the Neopuff device was being used to give Child A breaths as he had stopped breathing. She recalled being told it had happened suddenly. She recalled being involved in the resuscitation attempts and was physically holding Child A at the time. She recalled she had never seen a baby look that way before, with a skin discoloration on a pattern she had never seen before. Asked to describe the discoloration, she said he was, quote, white with purple blotches, with a bit of blue, and it had come on very suddenly. Just very unusual it was, she added. Many thanks for joining me for this episode. If you wish to keep up to date with the trial of Lucy Letby, please do give the video a like and subscribe to the channel below. Many thanks for joining me for this video. I look forward to seeing you all again for the next one. Take care.